Hi, podcasters. I'm Dr. Mary Larajani.
And I'm Dr. Rina Lau.
And welcome to the Skin the Surface podcast, where we are going to address various topics related to your skin. Welcome back, podcasters, to Skin the Surface. On today's episode, we will discuss one of the treatments we get asked about most frequently inside and outside the office, and that's Botox. You've probably all heard of Botox, but what exactly does it do, and who should be getting it? Today, we're going to answer all those questions and more. To start, Rina, can you give us some background on Botox and how it came to be a staple in our practice?
Of course. Botox was first discovered in the 1970s by scientists for the treatment of strabismus, or crossed eyes. Interesting enough, doctors who were using Botox for the treatment of crossed eyes or abnormal blinking or spasm of the eyes had noticed improvement in the forehead wrinkles in their patients. I'm sure if they had Yelp ratings back then, they would get 5 stars. Fast forward several years, Botox is now being used in a variety of clinical settings. Microscopically, Botox works at the level of the neuromuscular junction, which is where our nerves meet our muscle. Normally, these nerves will fire and cause our muscles to contract. Botox blocks this signal and then prevents the nerves from firing, and therefore the muscle can no longer contract.
It's important to mention that we often use the term Botox to describe all neuromodulators, but it's not the only product out there. Some other neuromodulators include Dysport, Xeomin, and the newest member of the group, Jeuveau. It's important to consult with your dermatologist to see which product is right for you, because not all Botox is the same. So now that we know what Botox is, let's talk more about what we can use Botox for.
So Botox can be used in a variety of different locations on the face, all with different intended results. For treating wrinkles, we can treat the forehead, around the eyes, nose, and even the neck. So some other ways Botox can be used is to reduce a gummy smile, to provide a lip flip or fuller lip, to reverse a downward turn smile, also known as a resting frown face, or even reduce dimpling of the chin. But a common misconception I find is that many people think Botox can only be used for wrinkles. Even though this is the most common reason we as dermatologists use Botox, there are so many other medical conditions it can be used for. Botox can be used to treat hyperhidrosis or excessive sweating of the armpits, hands, and feet. It can be also used as a tool to correct any facial asymmetry. We often use it to help with TMJ or those who grind their teeth frequently. And some other ways it can be used is to correct muscle spasms. So it's commonly used also by neurologists for the treatment of migraines.
So a question I often get asked by my patients is, how long will the Botox last and is it permanent? Well, Botox is not a permanent treatment for wrinkles. Most patients will typically start noticing results within 5 days, and those results are going to last you about 3 or 4 months. And for all our listeners, it's important to remember that results can definitely vary from patient to patient.
So now that we all understand what Botox is and where it is used, who should be getting Botox? Well, deciding on whether or not to get Botox is a personal decision and is not always dependent on someone's age. Once you begin to develop static lines, meaning wrinkles when your muscles are at rest or not contracting, you may want to think about whether Botox is the right option for you. People in their late 20s or even 30s may consider Botox as a preventative measure. The most important thing is to make sure you discuss realistic expectations, treatment goals, and maintenance treatments with your provider. Now, Botox has been notoriously associated with female patients, but over the past several years, the tables are turning. So as the stigma associated with male cosmetic procedures has lessened over the past 10 years, more and more men are now jumping on this Brotox train for many of the same reasons our female patients are. So does Botox in males differ from Botox in females? Well, yes and no. Male patients often need more units of Botox to receive comparable results, but overall, the treatment areas for males and females are similar. So now that we talked about who can get Botox, Mary, can you comment on who cannot get Botox?
Sure. So even though there's little safety data on Botox during pregnancy or when you're breastfeeding, we really advise against Botox injections during that time period. Also, for anyone who's had neuromuscular diseases such as myasthenia gravis, muscular dystrophy, and ALS, we also strongly advise against Botox because it can actually worsen the underlying neurologic condition. For the majority of patients, though, Botox is really generally well tolerated with very minimal downtime. There are some potential complications that can occur, though, and so you should be aware of these before you receive Botox injections. The most common event could be a temporary swelling at the injection site, some mild bruising, or even a headache. Depending on the area treated, other potential side effects include asymmetry, eyelid ptosis or heaviness of the brow, or even difficulty drinking from a straw. Very, very rarely, allergic reactions can occur. And this really highlights the importance of seeking treatment from a physician who's trained to understand facial anatomy and therefore can provide you with a careful and a thoughtful injection technique.
Yeah, I couldn't agree more, Mary. One of the largest concerns for our patients is the fear of being frozen, that Botox will make them look unnatural or even overdone. That is why it's so important to do your own research and find a provider who is a skilled, experienced injector. Often the goal of Botox is to have a refreshed, well-rested look, like you had the best sleep of your life. And you can tell the test of a true expert when the results are so natural when your friends and family are asking about new creams they're using and shocked when you tell them you had Botox.
All right, well, that's all we have for today. If you think that Botox is not a good option for you, or even for those of you who are thinking that it is, you should definitely tune in and listen to our previous episode where we discussed 3 over the counter topical ingredients for anti aging that every single person should be using on their skin every single day. Tune in next week as we discuss tips and tricks for managing that dry winter itch and how to get rid of that rough and bumpy rash on your arms and legs.